All right, so I think I'm free to start now. But hi, everyone. My name is Bianca. I am a respiratory student for the bachelor's program in respiratory care at Seattle Central. And welcome today. So before I start, I just wanted to ask you guys some questions. So you guys can always chat with me, or if you want, you can also go on your reactions and also just raise your hand or just say yes or no if you don't want to put it in the chat. But also forgive me if I do miss anything in the chat. I will leave some time at the end to answer all of your guys' questions. All right, so how many of you knew about respiratory care before this session, and did you know anyone in this program? Oh, sorry. Very cool. How did you know about respiratory care then, Robin?
Well, I'm a cheater. I work at I work at Central as a career advisor.
Oh, okay, very cool. All right. Okay, so I was just going to talk to you guys a little bit more about my background in healthcare and how I found out about respiratory care. So I work as a CNA and I'm currently working at Seattle Children's Hospital and I work in the ICU there. So I got introduced to a lot of respiratory therapists there and I just got to see more of what they do. And so one day I ended up talking to one of the RTs, and they actually were a graduate from the program. And they told me to attend an info session. They just like told me more about the program. And I realized that, so my original pathway actually was nursing. And when I went to the info session, I immediately loved it and realized this was more for me. So I'm just grateful that I went and I'm glad to be where I am now. So I'm about to graduate in June and I've experienced like the whole thing. And I'm just really happy that I'm a respiratory student. Okay. So, what do we do as respiratory therapists? We obviously assess patients' breathing and we're listening to their lungs, listening to their breath sounds. We're specifically looking at their vitals, such as their respiratory rate and their oxygen saturation. And we're doing that with the nurses and the other healthcare teams. And we're also helping to diagnose different respiratory diseases. So we work with different patient populations and this will include those with chronic obstructive pulmonary disease, which you can get from smoking. And then we have our asthma patients. So you have your childhood asthma to adult asthma, and then you have your neuromuscular disorders and your spinal cord injuries. So these patients have paralysis and their lungs have became weak, and same with like surgery patients. So you're just helping to manage those diseases and just helping patients to better manage their life with that disease. So I just also want to ask again, do you guys know anyone with the diseases that I mentioned or any respiratory disease? And if so, did it influence you to look more into RT because your loved ones or someone you're close to has worked with respiratory therapists? Here. I'm guessing that's a no. Okay. All right. Well, yeah, so apart from that, we also work with other nurses and doctors and other healthcare professionals. So you can always talk to them and advocate for each patient that you have. And you can change your treatment plan or your plan for the day based on your care. And then, of course, you have patient and family education. You're not only educating patients and their families about the disease, but just you can also educate them about the medications that they're taking or the devices that they can to monitor their symptoms. All right. So how do we treat? So we can give and we can administer medication, and it's mostly breathing treatments. So we have medications such as bronchodilators like albuterol to open up those airways, like if you know someone that's had an asthma attack. We also have corticosteroids to help with inflammation, and we have other maintenance drugs that we give. But we also initiate and monitor patients on mechanical ventilation, so if they have a declining respiratory ventilation status. But apart from that respiratory equipment, we work with a bunch of other equipment such as non-invasive ventilation like BiPAP and CPAP. And if you guys aren't familiar with that, um, sorry, I'm not sure if some there's something going in the chat because I keep getting notifications, but I'm not seeing anything in the chat. So hold on a second. Sorry, guys. Yeah, I'm not sure if I don't know where the IT person is, but I just keep getting these notifications, but I can't see anything in the chat. So if you guys are asking me something, I'm sorry. But yeah, so on top of mechanical non-invasive ventilation, you have your CPAP and BiPAP. And if you know someone with obstructive sleep apnea or they're snoring and they have trouble sleeping because they're not breathing when they're sleeping, then you also have those BiPAP and CPAP machines at home, and you can help um, those patients at their house as well. But you have your nitric oxide machines and your heliox machines that you can give to babies. And then you have handheld devices also that you can educate patients on how to use, such as your peak flow meters, just to monitor their asthma, lung secretion devices to help you cough up any like mucus and secretions you may have in your lungs, and then an incentive spirometry to help you take that deep breath, especially those that have been in bed in the hospital for a long time, just so your lungs don't get weak. All right. So, and then of course you interpret some lab and imaging results, and we're specifically looking at arterial blood gases and chest x-rays. And this will help to look at the monitor the patient's respiratory status, but it also helps with the level of degree of their disease and helping to diagnose them. Okay. So the different settings that we work in, again, I was going to ask for those of you who have stepped into a healthcare facility, did you meet an RT or were you curious about who they were? You guys just want to unmute for me if you guys do want to talk because I can't, it's still not showing up in the chat. Sorry, I keep clicking to the next one. Okay, well, yeah, so I'm just gonna keep going, but there's this misconception that we only work in hospitals, but obviously a fast pace or the setting just isn't for you. There's multiple options that you have, even though the main setting that we are in our hospitals, there's clinics, there's pulmonary rehabilitation, there's sleep labs, pulmonary function labs, home care, education, management, research, and obviously, with all these different settings, you might need like certain certifications, such as your PFT certification for pulmonary function. But what's really nice about this program is that with your bachelor's, it's a lot easier to advance to these different departments, such as like if you want to be a clinical instructor or if you want to become a manager at your facility, then it's just a lot easier with your bachelor's. But if you do enjoy working under pressure and fast-paced environments, uh, then the emergency department or critical care transport, such as this picture I have listed here for you guys, like flight RT might be for you if you like that adrenaline rush. But yeah, there's multiple settings that is available to you guys. That's what you like. Okay. So a day in the life of an RT. So I'm just gonna go off my experience as a student right now. Um, and just what I've been experiencing these last few quarters, like working in the critical care ICU. So basically, typical day is very busy. You're always on your feet. You're obtaining a report about what happened during the night and what you need to know on the day if you're working day shift, obviously. And then you're getting your patients and who you'll be taking care of. And usually for an adult hospital, like it'll be about 8 to 10 adults, and then with babies and pediatrics, it'll be about 3 to 5. But at most, as a student, I've only had two max patients, so that's just really nice. Like they definitely ease you in to gain your independence and work on your skills before they give you a big patient assignment. And you can work with all the way down to high risk deliveries, so newborns, all the way up to geriatrics. So again, like a wide range of patients that you get to work with. So you always have to respond to code blues, and depending on what department you're in, it will determine how intense that code is going to be. But as an RT, the healthcare team really looks to us to stay calm, because we're always at the head of the bed. We're the ones keeping and maintaining that patent airway. And if that patient is not intubated already, we're basically helping the doctor with intubation, and we're helping to ventilate that patient in order to reverse their declining respiratory status. So the whole thing is very if you've never been in that situation before, if you've never been in healthcare, your first code is definitely going to be an eye opening, but you learn so much and you realize how much teamwork the healthcare team has with each other when a code does happen. All right. So the job outlook for respiratory therapists, our career growth is growing faster than average compared to other occupations. And the need for respiratory therapists is actually growing 19% from 2019 to 2029. And as you can see in this graph here, it's 19% for us, and other healthcare professionals are about 10%, and all other occupations are 4%. So there's a lot of different factors that go into this. Obviously, I don't know if you guys know this about respiratory therapy, but this is a fairly more newer career in healthcare compared to like those like nursing where it started in 1600s. They introduced the first inhalation classes around like 1950, so it's fairly new. But with COVID and this pandemic, they've been recognizing RTs, respiratory therapists, and the profession a lot more. And they're realizing our essential role in managing this type of disease. And apart from COVID, there's also an increase in middle aged and older populations. And obviously, this will increase in respiratory conditions such as pneumonia and COPD and other diseases that can damage the lungs. So, with that increase in patient population, that's why there's an increased need for us. So, when you graduate this program, you never have to worry about job security. There's almost always going to be positions open for you, whether that is a hospital or it somewhere else like a clinic or pulmonary rehab, wherever you want to work, there should always be position open for you. Okay, so our average wage as a registered respiratory therapist. So I went off the median salary in Washington just because we are here right now, but it is 69,829. And obviously, that can range from entry level positions to your mid career from 63,452 to 75,916. This can all depend on your education, your certifications, your experience, and obviously where you end up working. But I also listed some high paying states here for you as well if you guys do end up moving. But for me, I also don't want to stay in Washington, but I wasn't sure if I wanted to just move to a different state or if I wanted to get my travel RT license. So that's basically if you like have like being flexible and going to different places. I just feel like this makes you a well-rounded RT because you are getting an assignment in a hospital. And it's usually like 3 months. And then if you like it there, then you can always renew the application and stay there for about max a year. But you're coming into these hospitals and you obviously need your ICU experience before you can become a travel RT, but you're really using your skills because all different hospitals have different protocols, and you it just really pushes you to like learn. So if that's what you like, then travel RT also might be for you. And also, it does pay a lot more than if you were just um, an RT in one state.
Like the traveling RT pays more than just staying in one state?
Yeah, it does.
Okay, thank you.
Mhm. All right. So, what is our program prerequisites? What prerequisites have you guys taken so far? And if not, do these science based classes interest you at all? And it's okay if you guys haven't taken any prerequisites, but the main classes you will be taking are your bio classes, your anatomy and physiology. You have some chemistry, along with English, psychology, and humanities electives. And if math isn't your forte, then you only have to take statistics. So that's really nice. But yeah, these are all the prerequisites listed. Um, but if you are taking classes already at Central, you guys know that it's located in Broadway on Capitol Hill. But our respiratory care program is taught mainly in the Pacific Tower, the Health Education Center in Beacon Hill, as you see in this picture right here. It used to be the old VA, I believe, but now the respiratory students occupy the sixth floor, along with medical assistants and surgical technicians. But the nursing students have the third and dental students on the fourth. So what's really nice about this building is that it's specifically only for healthcare students and allied health, and they remodeled it so we're fully equipped with everything in our labs, and we have um, a bunch of ventilators and medical gases that we can work with. And who wouldn't want to go to this building too with a nice view like that, right? But yeah, we'll hopefully, with everything going on, we'll be able to return like in-person classes by fall, and you guys will learn here. But now I'm going to talk to you guys more about the program. So we are the first respiratory care program to become a bachelor's program in Washington, and other schools have followed suit, but that was after us. But our program starts at the associate's level. So you come in with your prerequisites, and you don't need like any past certifications. You don't need any past degrees. You can be a transfer student too, because I was a transfer student myself, and it was fairly easy to transfer into Seattle Central. And you start at the associate's level, and then you obtain your associate's degree after your first fall quarter, and then you'll have a total of 90 credits, and then you'll transfer over to your bachelor's level classes. And this is specifically more towards your respiratory classes, and it's not like so much allied health anymore. And it's just more critical thinking and all that. But you also have some research literacy. You have your senior project to tie up everything you've done in this program, and so you could obtain your bachelor's. So I'll talk to you guys a little bit more about my experience as a respiratory student. Um, it's been a pretty wild ride, like you guys know, with COVID. So it's been a struggle to learn online, but thankfully we've only been pushed back just last spring quarter where we didn't go into class at all. We didn't have lab, we didn't have clinicals. We definitely made up those hours. But I think like for most of the people, like our reason for joining this program is we're all hands-on learners. And for me, I love going into like lab and going into my clinical facilities and just being able to do what we've learned in our books and in class. And what's really nice too is like with clinicals, we have access to all the Seattle hospitals, such as like Harborview and Northwest and Swedish. You also have Overlake and Evergreen, but you also have some up north like Providence. And I've worked with great, like amazing clinical instructors, and I've really gotten to do everything there. And it just really teaches you how to work in a hospital and become a well-rounded RT. So another benefit I like about this program too is you're learning with the same people in these same classes. So you really get close to your cohort. And we've also had about the same two teachers teaching us. So it's our clinical director, which is Scott Mahoney, and our director of the program, which is Jennifer Clark. And I think they're both here right now. But yeah, and then we also have some teachers also teaching us for like our pediatrics classes or patho classes, but mainly it's them too. So it's just really nice because you get used to their teaching styles and you, sorry, you all just get really close to each other basically because there's only about 25 of us in the program and then our two teachers and like a couple more. All right. So you're obtaining your license to practice. I'm only going to touch briefly about this because you guys will definitely learn more about this when you are in the program. But you have to take 2 exams in order to get your license. And so the first one is your therapist multiple choice. There's like 2 cut scores. You get your high cut score and you're eligible to take your clinical simulation exam. So with your TMC, that's just like multiple choice. And then your CSE, they give you a bunch of scenarios and then you answer based off those scenarios. And it's pretty much like select the answer multiple choice as well. But once you obtain these credentials, then you're eligible to apply for a license in the state that you want to work for. But yeah, and the NBRC is the one that gives you your credentials. Okay. So here's the application deadline. Our deadline is February 2022, and the next cohort will start in summer 2022. So this year, sadly, our applications only open up once a year, and it's already closed for this year in February. And this cohort is starting this summer. But even though it seems like a long time from now, you have a whole year to figure out your guys' plan and finish all your prerequisites. But the max cap for this program is 25 students. But I don't want you guys to get discouraged over that because we obviously take into account each application. And yeah, so basically you have these requirements that you need to do before you can apply, and you have to listen to this online respiratory care information session, and you're just attesting that you listen to that. You also have to go through another presentation just showing like our program quarter to quarter and what to expect out of it. And you just need like a very short essay that you need to write as well, unofficial transcripts that you need to send in, and then you need some transcript evaluation results. And your counselor is definitely going to help you with all of that. You have to take the standardized test. It's called the TEAS. And once you finish that, then you just send in all 4 of your scores. You can provide proof of previous medical experience, but that's optional. So like I said, you don't need like any past certifications or past degrees from this, but it's just always nice to see that on your resume. You also need a letter of recommendation, whether that's from a faculty member or a teacher or your employer. And then uploading a plan for completing your prerequisites, and that's optional if you haven't already by the time you apply in February. Just letting us know how you're gonna finish your prerequisites by the summertime. And then an application fee. All right, so we're at the end of this program, presentation, but here are the program contacts that I listed for you guys and additional resources that you can refer to. And I put down the Seattle Central Respiratory Care link. So if you guys want to learn more about the program, or if there's something I wasn't clear about or didn't go over, then you definitely can go there. I also listed the American Association of Respiratory Care, and it talks more about our career, what we do as respiratory therapists, and then the Bureau of Labor and Statistics, just like facts for you guys. And I have contact information here. So we have the health education center's address along with their hours, a phone number, the allied health email. But then if you guys have any questions for me as a student, I'm gladly able to answer them for you. Just go ahead and shoot me an email at bbayas20@gmail.com. And yeah, I would love to answer more of you guys' questions if there's anything else that you guys wanted to hear from me. Is there anything else you want me to go over? Something I wasn't clear about?
Thank you so much for this information. This has been great. One thing I'm thinking about is if you know of any of your classmates, if they're already seeking out in employment, or maybe someone that was in the cohort above you, if you know where have people been getting jobs out of this program?
So right now we haven't applied to any uh, jobs yet, just because we do still have to pass our exams at the end, like I said, and like get our credentials. But from the past uh, RTs that I've talked to, almost everyone has gotten a job within the Seattle area or even up north. I know some people moved out of state, but even when I like go to my clinical sites, I meet a lot of Seattle Central like graduates. So like at Harborview and Swedish Evergreen, Swedish First Hill. I work at Children's, so obviously like a handful of them work at or have been to Seattle Central. Um, as for the other ones, I know some people went down to Oregon, and I know some of my classmates want to go to California and Alaska, Nevada. So like everywhere, everyone's been hired.
Thank you so much. That's exciting to hear. I know it's very much in demand and they need more RTs. So I'm glad you're getting through the program and that it's been a good experience for you.
Oh yeah, for sure. Like I said, you always have job security. There's always going to be a position open for you. So yeah, it's a very exciting profession. So I hope you guys really consider it. All right. Is there any more questions? I'm sorry about the chat, you guys. I just, for some reason, I can't see it and I don't know where IT is.
Yeah, I don't know what's going on with that because I'm not even seeing any chat on my end, but it's not blinking either. So unless people are sending you individual messages, I'm not sure.
Yeah, that's really weird because if they sent individual messages, I feel like I should see it still too. But yeah, it's okay. It's just a little technical difficulty. But yeah, does anyone else want to unmute and ask any more questions? Or was that it? All right. So like I said, just email me or email Allied Health if you guys have any more questions or any concerns. Yeah, just go ahead and email me. But thank you guys again so much for listening to this session. I hope that there's been at least one thing that interested you, if not for you guys to join this program. But respiratory care is really, truly a rewarding profession. And like I said, I'm just so glad that I joined. So yeah, thank you guys again so much.
Thank you. You did great.
Thank you.
Bye.
Yeah, I can go back to the main room now.
Yeah.
Bye, guys.
Hi, Bianca.
Hi.
I didn't get to hear most of that, but everybody just finished their test. So I just wanted to say thank you for doing this for us. We really appreciate it.
Yeah, for sure. Sorry, I was like having such technical difficulties because I've never presented on Zoom before. So I'm like, I feel like someone's chatting, but I can't see it.
And for the couple of people that showed up, I don't know if they know that a couple of other people from our program are here. So Ariana or Aiden or Shannon, if y'all have any questions, you've got lots of people here ready to answer your questions.
Are they in the program right now? Or who is it? Yeah, I think we're going to go back to the main room just because I think the session's about to end. Okay. All right. Bye, guys.
Thank you.
Thank you.
Welcome back, everyone. We're going to open up the breakout rooms for session 2 shortly. Just give us a few minutes and we're going to open up the breakout rooms for session 2. Thank you. All right, opening up the breakout rooms for session 2. If you need help getting to your room, drop a note in the chat and tell us where you want to go.